A common question from childbearing age women is, can newborns, infants, toddlers, or children be adjusted? And my answer is yes. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Why would you have your newborn, infant, toddler, or child adjusted? And for what reasons would that occur? Well, let's take a newborn, for example. Birth is potentially one of the most traumatic things that your neck will go through. Think about it. Baby comes down the vaginal canal, and the first thing to leave in a normal birth is the head. And like it or not, in the hospital, they're going to pull the head to try and get the baby out. Now, whether they're pulling with the doctor's hand, with forceps, or with vacuum extraction, that head and neck is receiving a lot of force. And if you want to dig into the physics of it, check out an interview I did with pediatric chiropractic expert Abby Ballard in January of 2018 on my YouTube channel. But when pulling on the head, there's potential that there could be misalignment in the neck of the newborn. Well, the brain controls everything in the body, right? So for lungs to function, for muscles to function, for everything to function, they must receive the message from the brain down the spinal cord and out the nerves that end in that organ. So any misalignment in the neck in a newborn potentially can affect the growth and development of that child. And so a newborn ideally would be checked as soon as possible after birth for proper alignment to ensure proper and optimal growth. Now, the adjustment that a newborn receives does not look like the adjustment that I receive. So there's none of the head twisting or any of that going on in a newborn. A newborn is essentially a bag of cartilage with a head on it. There's not even bone yet. Okay, the bone hasn't ossified. So basically, the adjustment for a newborn looks like I'm just doing some muscle work to it with a little bump. There's no turning of the head. There's no popping or cracking, anything like that. So it's very safe. It's very essentially almost no impact. And the baby may cry just because it's the first. I mean, it's a new experience, but it's great. Also for babies, you may work on the pelvis because of the impact of the sacral plexus or the nervous system in the pelvis and the impact it has on constipation or colic or reflux. So chiropractic for colicky babies is very effective. For torticollis, when their head gets stuck like that, is very effective. For constipation is very effective. If you have a baby that's feeding on one breast but won't turn its head to feed on the other breast, chiropractic is very effective in helping the range of motion for that baby to be able to feed on both sides. So very, very important for the newborn. And as you go up in age, the importance is just as important or maybe goes up higher, because as we get to the infant stage and they start to crawl and then they start to walk as toddlers, they're developing the curves in their neck and their low back, and they're also falling a lot. So the statistics are that an average toddler falls, over 2,000 times while they're learning to crawl and walk. And so that's a lot of potential trauma to their body, to their spine, to their head. Look, even this doll is anatomically correct. The head is the heaviest part. So when they're falling, I don't know about you guys, but with our second daughter, we used to joke and say her head was a magnet that was attracted to any sharp corner in the house. It seemed like she fell a million times and it was always head right into the corner of something. We joked that she should wear a helmet. Well, I would check her often and adjust her because that's head trauma, head trauma, head trauma. And lots of little head traumas can potentially lead to issues down the road. Also, in growing toddlers and in children, we want to periodically assess their spinal growth and development and keep it optimal, because we want to prevent scoliosis. Scoliosis is when instead of the curve is straight, it starts to make an S. And research has shown that scoliosis can decrease lifespan by up to 11 years due to the change in nerve supply to the organs and organ dysfunction that results from that. So preventing scoliosis in growing children is another great use of chiropractic. To wrap it up, chiropractic is very beneficial and very safe for children of all ages, from newborn all the way up to 100+ years old. It's also very beneficial for pregnant mothers before the baby's even born, to make sure there's enough space in utero for baby to do its jumping jacks and jump ropes that it's doing in there, and to turn and be head down as you approach pregnancy. So if your child suffers with colic, with constipation, won't turn its head equally to feed off of both breasts, if they're having reflux and spitting up a lot, all of these things can potentially be helped with chiropractic, and in many, many cases have been helped by chiropractic. And it's a non-drug way to address it. So on the scale of conservative to aggressive and invasive, a chiropractic adjustment would be way down here on the conservative side. Then you're talking about medications like Miralax or the omeprazoles or the different PPIs they give, all the way up to invasive procedures that don't usually happen in babies. So call your local chiropractor and get your baby checked and start their life out towards optimal.